Hello YouTube, this is Dr. Mark Haverkorn with River City Oral and Maxillofacial Surgery in San Antonio, Texas. Today I just wanted to do a hopefully brief video about the three types of surgery. So patients ask me all the time, do I need to have surgery? Do I have to have surgery? What happens if I don't have surgery? And that's kind of a different topic. But regarding the need for surgery, there's really only three types of surgery. It doesn't matter if you're having surgery on your brain, your heart, your face, your mouth, whatever. It's either going to be elective, it's going to be urgent, or it's going to be emergent. Okay. Elective surgery, we all know that's going to be obviously cosmetic surgery, and then sometimes elective surgery would be things like taking out your wisdom teeth to prevent problems where you don't have any problems right now, but just based on the whole circumstance, the clinical picture, we think it's pretty likely that you will have problems, and so we're trying to prevent that. Urgent surgery is stuff that needs to be done, but it doesn't have to be done immediately. So maybe you've got a few days or even a few weeks, but it's something that needs to be done. Obviously, things like cancer surgery and pathology would fall into that category. A broken bone would fall into that category. Maybe we don't have to do it today, but we need to do it in the next few days or the next 2 weeks or something. And then the last category is emergent surgery. And that's usually pretty obvious. I mean, if you've got an aneurysm that's gone bad and it needs surgery right now, a gunshot wound, so obviously trauma, right? Gunshot wound, knife wound, some sort of blunt force trauma in a car wreck. You know, if we don't do surgery, you're going to die. And so those would be emergent surgeries. So when you're trying to decide if you have to have surgery, you know, the first thing is just to think, you know, unemotional, try to set the emotions aside and think, okay, do I have to do this or I'm going to die? You know, most of the time, well, I would say a lot of the times when you need emergency surgery, you're not even going to be the one making the decision. You're not going to be capable of making the decision. So if you have time to think about it, it's probably not emergent surgery. So then that leaves you with urgent or elective. And there's no, well, so with urgent surgery, you usually should have it done or need to have it done, but you have a little bit of time. You might even have enough time to go get a second opinion or a third opinion. And you may even decide you're not going to have the surgery. That may have some consequences, and those consequences may not always be life-threatening. But you can make that decision for yourself. You can ask your doctor questions about it. And then there's elective surgery. And in those cases, you just got to weigh, you know, the perceived benefit, so whatever that is, whether it's cosmetic or preventative or whatever, against the cost and the downtime from the surgery. And then, you know, how major is that surgery? How likely is it to have complications? If it's a really low complication surgery, like taking out wisdom teeth, that's one thing. If it's something that's got either a higher rate of complication or the complications are potentially worse and more problematic, then you may decide against it. So you could have an elective surgery that rarely has complications, but when they do have complications, it's absolutely terrible, and that may make you decide not to do it. Or you could have an elective surgery that rarely has complications, and when you do have complications, they're not that big a deal, and then you say, okay, I'm going to go for it. But anyway, those are the three types of surgeries, emergent, urgent, and elective. And when you're trying to make a decision about surgery, just keep those things in mind. Try to think rationally about it. Even ask your surgeon, hey, is this elective or is this urgent? And if you don't get a good vibe, if you don't think that they're shooting you straight, get another opinion if you can. You know, most of the time, if you're in a surgeon's actual office, not in the ER or something, if you're in the office, you've probably got time to get a second opinion, even if it's something that needs to be done pretty soon. You know, don't fall into the trap of thinking, I've got to do this right now and I don't have any choices. A lot of times you have choices, okay? Even like a broken bone, depending on exactly what it is, of course, a lot of times you can get another opinion. You can talk to a different surgeon or a different doctor. So hope that's helpful. If you have questions, leave some comments below, leave questions below. I'll get to that.